Hi, my name is Dr. Brian Slomovitz. I'm a gynecologic oncologist. I'm the director of gynecologic oncology at Mount Sinai Medical Center in Miami Beach, Florida. And I had the honor of speaking about the gynecologic cancer sessions that were presented at ASCO this year. I think there were a couple of high-impact studies, the most important one being the Athena trial that was presented by Dr. Bradley Monk. This was a randomized phase 3 trial looking at rucaparib versus a placebo in patients with newly diagnosed ovarian cancer. This was actually the Athena mono trial, as there's an immunotherapy arm which will be reported out at a later date. In this population, the ITT population, the intention to treat all comers, showed a significant improvement in PFS, as did those patients who were HRD homologous repair deficient. And in a subgroup analysis, we also saw a benefit in those patients that were homologous repair wild type, or in this study, a tumor agnostic group. They didn't have a biomarker positive. Based on these results, we see now that there's 2 PARP inhibitors in the frontline setting that have benefit in all comers as far as maintenance therapy, both the rucaparib demonstrated in this trial and from the PRIMA trial, niraparib. We'll have to see if there's an FDA approval of this drug, but the data itself is very exciting. In addition, we saw some other studies that were very interesting at the ASCO session. We saw a retrospective study out of Japan showing that bevacizumab, in addition to chemotherapy, helped patients with clear cell carcinoma of the ovary do better. Otherwise, in the ovarian cancer sessions, there was a positive phase 2 trial of relacorilant, which is works in the glucocorticoid pathway, and we're excited for an upcoming randomized phase 3 trial that's going to be done by GOG, and also a global trial in the near future. In the cervical cancer space, we saw that the staging of cervical cancer, whether you use the FACOG 2008 guidelines or 2018, in the 2018 guidelines, there was an improvement in outcomes, but this is most likely due to stage migration. We also presented several positive trials of tisotumab vedotin, the TIVDAC trial from CGen. And in this trial, we found that in combination with pembrolizumab or with carboplatin, there were positive outcomes, necessitating further studies in this frontline setting, moving it forward from the current FDA indication in the second or third line. Finally, in the endometrial cancer studies, we found some positive outcomes of the NAB sirolimus in patients with BComa, but as we know, mTOR is an active pathway in the treatment of endometrial cancer, and future studies will need to be done looking at that pathway. And then we also was presented the final Garnet data, looking at the activity of dostarlimab in both dMMR endometrial cancer patients and proficient MMR, or microsatellite instability and microsatellite stable, showing the response rates there. And along the lines of the FDA indication for dostarlimab, there was activity in the dMMR population. Finally, the last study I'll mention is a subgroup analysis in the SIENDO trial, looking at selinexor maintenance therapy presented by Vicky Macker. And in that trial, we found that the activity of selinexor and the maintenance therapy was more prominent, was better in those patients with wild type P53 as compared to the mutant P53. We know from the results of this study that we're going to be most likely moving forward with a secondary study looking at the role of selinexor in the maintenance setting just in those patients with wild type P53.